Welcome everybody to our Wednesday finance meeting. Today we do our annual review of the fiscal budget for human services. Always an interesting exercise. So without further ado, I'm going to turn this over to the finance folks. I am turning this over to Tammy Bender to begin the festivities. Annie.
First thing we want to talk about is children and youth. Turn it over to Wendy with your needs-based budget match.
All righty. We're just within the next few weeks going into the submission of our 15-16 implementation plan and the 16-17 needs-based. Of note is that in 14-15 we added 2 positions that were not actually allocated with state permission. They approved by doing that. With the agreement that there would be no increase in the allocation. At this point, we're doing pretty well working within that. That's as of the third quarter and on the expense side. Of course, we don't have revenues until much later. Fourth quarter is always higher, and we're dependent on how the revenues play out, but we're cautiously optimistic that we'll stay within or very close. And we appealed that one, and so in case of another match, we made whole.
So on a scale of 1 to 10, in terms of cautious optimism, 1 being...
Yeah, which direction we go?
Yeah, 10 would be extremely optimistic, and 1 would be extremely pessimistic.
7.
So pretty good.
She says 8, so that's pretty good.
I believe her.
Yeah, absolutely. Okay, so then for 15-16, we pulled 2 15-16 positions early, and we're actually beginning the interview process for those. Those are in the 15-16 budget, but only as a 6-month cover, so we'll be doing the same kind of, pinch and pennies to try and stay within that allocation. And if we continue the same increases in referrals, we may need to come back to you. So I am less optimistic than 15-16. Hard to tell, but less optimistic. We did get an increase in 148, but that increase was not predicated on the kind of increase in referrals that we got. I was asked to bring you the referrals. I'll just pass those around. This is just January through March showing.
Can we go back on another appeal?
Yes, we will.
Okay.
We will appeal once we get the certified numbers, once the budget passes, hopefully in July. Then we'll appeal those certified numbers. We basically do that every year just to have a foot in the door if we need it. Okay, we were also asked to talk about that, and Lisa has some handouts for you on the overmatch, the lag time it takes to get the payment, and this gives you the full history.
I went back to fiscal year 02-03. Out of the 12 years I have listed here, 8 of those years we were in overmatch, and 8 of those years we were made whole without having to go to appeal. So I'm very confident that they continue to make us whole without going to appeal. But I guess as far as the lag time regarding overmatch, the one that stands out the most is the most current, the 12-13 fiscal year, which we just received payment early in April. That was the longest one. The state was behind in their payments and all their payments this fiscal year for some reason, but in previous years we've been made whole pretty much after I would say within the next year. So it's been pretty good.
And we were not overmatched in 13-14, so we're not waiting for that.
Yeah.
Okay.
At least 12-13, the amount wasn't as high as some
Right.
previous years.
Right.
And that's because when you have a high year and you're in high overmatch, then 2 years out, your numbers are based off of actual. So you will see a lower amount of overmatch in the following
It's a
year.
correction.
Yeah, it's to catch up for.
Okay.
Yeah. Especially like after the fiscal year 6-7, when it was $1 million overmatch, the next year was considerably lower.
My only concern for being made whole in 15, 16, is that Childline, Office of Children and Families is also putting on staff based on the new laws, and so are other counties. So how much will actually be left to divide is my
Just
question.
come back to the counties, yeah.
But then we'll also have the formal appeal to fall back
Right.
on. if-
Right. We would have to decide if we would expend the attorney costs and everything and pushing through the appeal.
Wouldn't it be just easier to fund with mandate?
We would think it would.
That's a good one. Nice.
So, that's essentially where we are.
That was the idea of needs-based budgeting way back when. That was the thought.
To fund the need.
Yeah.
Hence the name.
Right.
We're just gonna go around the room, if everybody can kind of update us on how the proposed state budget affects your department. Do you have anything with that, Wendy? How the state budget's gonna affect children and youth? Do you have anything else?
We actually did get an increase, as I said, not as much as is needed, and given the publicity around what's happened, I don't know how they could propose cuts to it, but stranger things have happened too.
But if I'm reading this correctly, the county subsidy is going up, right? In the new budget.
It always does, but until we get the final expenses and revenues in, it always ends up finalizing being lower. Like,
Okay.
for fiscal year 13-14, we came in at, well, it depends on how the revenue and the expenses play out.
But you'll
So I
always
put worst
see
case
the
scenario.
ones that we're projecting. Lisa does this worst case scenario, and also you don't have a full picture there. So
Okay.
we'd rather tell you it's going up than tell you it's going down and have it go up.
For drug and alcohol, in the budget proposed by our new governor, we are seeing increases proposed for the first time in probably 12 years. In most of those previous years, we've seen decreases or at best flat employment. And it's not a big percentage increase. But part of the money that was cut 2-3 years ago, the line items that are part of the human services block grant that were cut by 10% are being restored across 3 years, or at least that's the proposal. So we're seeing a 3% restoration in our case, the Act 152 and the BHSI money. In addition, there are some special funding boosts for both the Department of Human Services and the Department of Drug and Alcohol programs associated with the opioid epidemic. I think $5 million in the case of DDAP and $2.5 million in the case of DHS. How that will be rolled out remains to be seen. Well, whether it actually makes it into the final budget is the larger question. Because the governor's budget is so far afield from what has existed in the past, and there's so many interlocking parts, we have budgeted at the county level in a very conservative, and we're assuming a flat fund, which in most years that's a good year for us. If we're fortunate enough to see some increases, then we will rebudget and accommodate those. Where we would most be able to benefit from additional funds is for inpatient treatment. I think commissioners, I think you know that once again this fiscal year we reached the point about probably 6 weeks ago now that we were no longer able to make inpatient non-hospital rehab and halfway house placements expensive and regular outpatient services. But we're not in a good situation, particularly when we're seeing unprecedented levels of heroin and opioid medication use. So we were being hopeful that, like all the publicity surrounding child abuse, there's been a lot of publicity about the opiate epidemic as well, and that at least some of these proposed increases will stick, and we might see some increase in funding for treatment.
And now the synthetic marijuana, for those overdoses that
Yes.
just made all the news over the
Like
weekend.
we didn't need another
Exactly, one more substance.
serious
Yeah.
territorial.
I mean, just the amount of money that we need to pay for naloxone for all the people now who seem to be willing to, administer it.
And that's one of the things that's unclear is that if any of that money, that new money, is going to be earmarked just for naloxone, which would be great, we'll use all the help we can get, but there are a number of private insurance companies that are putting forth some initial funds to equip police departments with naloxone. And my concern is that I want to do everything we can to get naloxone in the hands of anybody who can use it, first responders as well as friends and family members. But once you save their life, they're still addicted. And so I still need money to help treat those who don't have insurance to cover the cost of their treatment.
So is BSB taking that out of their own budget? Is that being
No,
a
that-
new increase to their budgets to cover this?
The initial cost, as I understand it, is being put up by private insurance companies. The initial cost of equipping all state police cars with,
But you can't equip it once.
you need
You
to
need
give
the
it
life.
replenished.
I mean,
The shelf life
needs to be
is,
sustainable.
it's about 2 or 3 years of shelf life with naloxone, if it's unused.
Okay.
And then once you use it,
Then it has to be replaced, sure.
And there's a patchwork of arrangements. We're fortunate that DA3 has come up with a way to help locals, but there's no uniform policy.
He's come up with some funding as well. And so we have some money to get people started, but there is going to be a need for some ongoing.
Well, a significant portion of the county is covered by state police.
Yes.
So that,
Yes. And of course, we serve Perry County as well.
Exactly.
They have very few local police departments. We do have a number of our local police departments that seem very interested in getting the necessary training for their police officers. So in the coming months, we'll see some of them starting to actively use it.
If they could only develop a variation of naloxone, which, aside from rescuing you from death, could also supply you with a stable family life, a college education, and a rewarding job in a stable community with a good district with good schools, then I think we'd be in pretty good shape. But I hear that's a ways off.
I think so. I can't hold my breath for that.
Don't be talking about all you want.
On the IUDEI side, speak to the first, it's relatively flat funded. They'll be operating in the same budget as we had this past year. As Jack already referred to, the 3% increase to restore the funds taken from ID 3 years ago. The budget this year also includes a 1,000 person waiting list initiative to include graduates, around 600, and the other 400 will just come off the main list. The waiting list is pretty extensive, but about over 15,000 people on the waiting list for services. So this is just a drop in the bucket, and this waiting list is a statewide waiting list. And a small initiative for autism, which really, like 50 people, really doesn't cover the
statewide.
Yeah, yeah, really small.
So our waiting list here is,
Our waiting list here is about 75, 74 on the emergency list, which are those saying they need services right now. And about 150 on the critical list, which is saying that they need services within the next 2 years. And the rest of it is in the planning category. We serve about 1,000 individuals.
but only those who have a need for service, those who are already served are not on the waiting list. I mean, they have no need. And then we have individuals who are registered who have no need yet, so they're not on the waiting list. So the ones that
How
are
many
there.
are currently being served?
I'm sorry.
Sue, how many currently being served in Cumberland, area?
About 1,000.
1,000?
Yeah. Give or take a few. That's
Is
Cumberland and Perry.
is the size of our list, I mean, is that been going up? Is that the same, about the same?
Stays about the
emergency-
same.
Like the emergency list?
Yeah, they stay about the same. You know, at one point in the year when the grads are getting ready to come off, the waiting list for the emergency group increases. And that's where we're seeing it right now. But once they graduate and receive their funding, then they'll come off again. The waiting list will go back down about 20 people or so. Because they move up to emergency about 6 months before they graduate. So that we know that they need funding. They're not just going to sit at home once they graduate. So.
I feel like it's the same old song. Governor's proposed budget, 3.3% increase, but it's not really an increase. Remember 3 years ago, 10% of base funds were cut from mental health ID and some from drug and alcohol. So it's actually a restoration of some of those funds that were cut. Cumberland Perry MH lost about 1.9 million with the cuts. So any restoration of funds is only a good thing. We're just waiting to see what happens with that. We're doing all of our contracts, flat funding for both MHID, for all programs based on this year. And then if we do get the once we get the allocation, and if there is in fact an increase, then we'll start to look about where we're going to start to restore or develop new services depending upon what the data continues to show around needs.
So that 1.9 million lost, that's cumulative, or is that the annual one?
That's what we lost every year. Yeah,
Yeah.
our base went from almost 11 million down to whatever, 11 minus 1.9. So yeah, it's actually been over the 3 years. Well,
About 6 million.
yeah, about 6 million.
We're going to talk about your provider issues now or afterwards we go around.
I don't know. I mean, whenever.
We go around and let everybody.
Yeah.
If that's okay with you. Thanks.
Aging budget is, as far as we know, staying basically the same. Over the past 2 years, they had the option spending, which allowed us to get rid of our waiting list that we used to have for consumers. That is now gone. It looks like that money will still be coming in again next year. We had added a couple of new initiatives during this past year with the PERS units, the personal response units for older people, and that seems to be going well. We added for the Shippensburg area, not just having the frozen meals, but of having home delivered meals that was more of the hot. That seems to be going well, those kinds of programs. So if the funding stays the same, we will be able to do those things again this year. And we don't have our budget as of right now.
But if it doesn't, are those services going to have to again be cut?
Well, they may possibly, but the way our money is working, it seems that the number of people that are coming in has increased, but it's not a great number. We think we may be able to work within where we are. So I cannot say that it would have to be cut. We may not add any more. We may have to go back to a waiting list, but I don't see us having to cut the program out.
As long as the legislature doesn't borrow more money from the lottery fund to pay for nursing home care.
True.
Then, hopefully we can continue to see these programs continue. I was pretty impressed with the number. There's been a significant increase in the number of seniors using, getting the PERS units at the last
Right.
aging advisory board meeting.
Right. I think we're up to like 160, and although 160 is a lot of people, we're talking $30 a month, so overall, it would be no more than $50,000 for the whole year of PERS units, but that's what the largest number of increases has been.
I think my concern is that the program is established, and then cannot be sustained.
Right, I really don't believe that we're there.
Even though we have a waiting list.
Right. I think we would have to go back to a waiting list more than cutting the program out. From what I can see,
Hey, your 160 people receiving this, is this spread pretty evenly across the county?
that part I don't know.
That's a good question. I just noticed it was at the last advisory board meeting, it seems like there's more and more seniors that are taking advantage of this program. I mean, it's a good thing. If something happens, so they just press the button as opposed to maybe laying there for days. So it's a good thing, but yeah, we could maybe get some more details on that.
Sure.
Same thing as Jack and MHID being the 3%. We put back in the budget for HSDF, the Economics Assistance Program. As far as the food programs, as I know right now, that is staying flat funded. So, other than that, no other changes.
About 2.5 weeks ago or so, I sent Larry an email and said, gee, I hate to be pessimistic, but given the Governor Wolf's budget and all of the changes and things that he has as part of that budget, I'm really questioning whether or not it would be passed by July 1.
2015.
Yeah, 2015. And actually, Sue and I were at the PACA meeting, which is the MHID administrators meeting last week, and Brenda Penyak, who's CCAP legislative person, said that she, the thinking is it is highly unlikely that the budget would be passed by July 1, given all the intricacies around different revenue and legislators and, all of those kinds of things. So I think that, as you recall, in fiscal year 9-10, the state budget did not pass. And the only revenue source that MHIDEI has comes from state and federal sources via the state. When the budget does not pass, the state cannot cut checks. And so there is no revenue into the agency. So when looking at that situation, in the past, what we have been able to do, thanks to you guys, is to continue services with money coming from the Commissioner's Office, the General Fund, in order to pay for those services. And then when we were provided our allocation, which in 9-10, we got both first and second quarter allocations in October, we were then able to pay back the money, and that allowed our providers to continue to provide services. Many of our providers, even if they're fairly large providers, have only, or many of them have no other sources of revenue other than county-based funding. Our residential programs, about 75% of crisis intervention, the supportive kinds of services that allow people to live in the community and be supported in the community. So I did put together some figures around monthly cost for MHIDEI. They're there. Mental health is approximately $735,000 a month. ID is approximately $235,000 a month. And EI is approximately $220,000 a month.
Just really quick, the fact that the providers have cash flow issues, it's not because they're not billing, it's not because they're inefficient.
No.
It's just that the way they operate their business is sort of inherently, they don't have a lot of reserve
Right.
or money they can move
Right.
from pot A to point B.
Right.
So this is, because, in our discussion yesterday, the steering committee, I mean, there are some providers out there who won't be mentioned in other areas who seem to have trouble getting their bills in on
Right,
time.
right.
So,
Our
but
providers
this-
are basically very good, bills are due into the county by the 15th, they're in by the 7th of the working day, they're in, they do a good job of billing, they do a good job of following up with bills, if most of the programs are paid on a per consumer service kind of basis. Do a good job, take a lot of accountability, but they're not large providers, meaning if they run a residential program in Cumberland, for Cumberland Perry, that's 10 people who they are providing 24/7 services and support for, with the only revenue being what comes from base funding. So there's no other cash coming into the program. Many of our early intervention providers are contracted providers, and so the only resources they basically have is what comes from us, and also some of the EI kids who are on waiver medical assistance, but that's very few. For IU, base funded folks are base funded. There's no other option for revenue for those folks. So it's not that there are alternatives around being able to have resources to continue.
Right, so they're not having a continuous flow is going to really impinge on their ability
To continue to
those
provide the
services.
services.
Like, i.e. they would have to lay off staff, cut that, shut down. on
They
those.
probably have to shut, yeah, because they would not be able to have any resources to pay staff.
Okay.
I think if there is a serious concern about the budget not passing, we all went through that before. I think the county was on probably better ground.
The state-
No, it's 101 days is what we were able to let.
Mhm.
I do not believe this budget is going to pass on the 1st of July. I'll just flat out say that now. So here we are on the 1st of May, arguably, that the county should responsibly look at finance to see where and how this may play out, rather than, sort of on the 29th of July, or the 5th of July, or who knows when in July this is going to take place. So, it's nothing new.
Right.
Yes, the last four were successful one time. I do not believe this one, for a variety of reasons, is going to happen on the 1st of July. But the responsibility that we have as a county is to ensure that there is a seamless service stream to everyone who needs it. And I believe we're financially able to do that.
And when we got the 101, I'm sorry, go ahead.
No, I was just going to make an editorial comment as well. As a student of the legislature, someone who's actually worked there for over 30 years, I can remember many a morning on July 4th watching the sun come up as the General Assembly finally got its job done. I mean, this is their obligation, to pass a budget by the June 30th deadline. I realize we have a new governor, but there is really no reason for the legislature not to pass a budget on time. So, what I've seen over the years, having worked there, and it's unfortunate the way it works, but when there's a crisis, that usually forces the legislature to act. So while I appreciate the fact that this county is prepared to pay our providers so that there will not be any interruption of payments, the fact of the matter is I've seen that, essentially providers not facing the prospects of not being paid is, again, unfortunately, what has moved the legislature to get its act together. So I'm not saying that we should not pay our providers. What I'm saying is that there's going to be a lot of other counties in the state that hopefully, are not in our situation, that are going to be able to do that. So there's no reason for the legislature not to get its job done on time. They need, because they will get it done. Question is, when are they going to get serious about it? when they're gonna get serious about the work that they have to do. It's their obligation.
So we're, what's the total? If it comes to this, what's the total here that we're talking about? Is it 1.2 million or is it?
About 1.2, I didn't get it up, 1.2.
Okay, the difference, you have a number, then you say with approximately blah, blah, for service
Oh,
continues.
because the first number includes staff benefits and all.
Here's-
Department staff, MHIDEI staff benefits and all. And then the second number is for the service providers.
Okay, so does this include the part that the county would normally pay anyway? Or is this over and above?
Yes,
that?
it does.
It's all inclusive.
It'll be it's about 4% of the bottom line.
And in the time that it happened previously, the state did continue to make some payments to mandated services. It wasn't everything, but it didn't completely drive all of the funding. So it's not going to impact every fund the same. It's going to depend on what the state approves for funds.
How does it-
Probably be funded. Were you guys funded the last time? No? I mean, none of MHID, when EI is mandated, but
They're all mandated.
Yeah.
It's the things that follow I believe it was the Medicaid dollars.
well, medical assistance,
Yeah.
yes.
They can
Health
bill.
choices, yes, they can bill for that. That's a completely different pot of money than this money.
Okay.
Yeah. Completely different. You're right. Medicaid, yeah, medical assistance, health choices, they continue to move forward with funding. But Medicaid only pays medical assistance pays a small number of services and supports for certainly a significant number of people. It's a wonderful thing, but it does not fund, bulk of it does not fund what base dollars fund.
So this is a question for Dana. Anything on the phone? So this is roughly 1.22 million a month.
Correct.
Okay. And again, because it's our job to be worst case scenario, at what point, if for some reason there was an extended period without it, at what point would it begin to become a serious concern to our other operations?
Without sitting and running the numbers, I would say we would probably be okay to close to the fourth quarter.
If we hit that far, we are all serious, serious.
If the canoes and the paddles
No,
out.
and I mean respectfully for everybody, the governor, the General Assembly, everybody in the Commonwealth, if this goes past what is a reasonable period of time, it is a lot more. And other counties just simply will not be able to survive that.
What I'm kind of basing pulled out of the number on is the previous time. You know, we have some grants that are billed in arrears.
Right.
And so that wasn't impacted as much because we had the, you know, at the end of the first quarter, and we still didn't receive the money, but we wouldn't have received it until the end of the first quarter
Anyway,
anyway.
doesn't matter.
So there is.
Yeah, and that's where some of that is.
Yeah, so the impact you start feeling is in that, the
So-
second quarter, their second quarter, our fourth.
And I think, let me make another observation. So we have how many state house members here in Cumberland County? 6, something like that?
Yeah.
Okay. So they won't be getting any heat if the budget isn't passed all the time, will they? Another observation.
So, again, worst case, no building is hard. Oh, it can't rain that much. But, so if we got into the end of September and things look pretty bleak, we might have to sit down, or even possibly before that, and start to make some contingency plans to stretch stuff as much as possible. Hopefully,
It doesn't have to be beyond June 30th if everybody can get their heads together. Yeah. I think under Governor Rendell, there wasn't a final budget till December. I remember when I first started working in the legislature in the fall of 1977, Governor Chapman, who was the governor at the time, they still had not passed the so-called non-preferred appropriations, which is the funding for our state-related universities, Penn State, Big Temple, and Lincoln. And they finally got that done, but it was sometime in the fall. But yeah, I mean, it's some years it goes a little bit beyond, some years it goes a lot beyond the deadline, and there's really no excuse for it. I mean, I worked over there for over 30 years, and I never understood why they couldn't, essentially get together, because you're going to have a budget sooner or later.
So what other good news do you have?
Okay, thanks, so what else we got?
Rapid transit, if we can just go around the room, what kind of impact will rapid have on your workload and on your budget? Let's start with-
For us, little, because we don't have a Medicaid funded part of that, but I did ask it on our steering committee yesterday that we find out if they'd be willing to do visitation transportation for us that we would pay out of our expense. Because we're currently paying cap for that now, and I suspect maybe it could be a better deal.
Or maybe a more efficient deal.
Yes,
So the efficiency might be the element there,
plus we have Saturday service.
or a responsiveness.
That
is
service
huge.
would be amazing.
Yeah, that would be a big contributor to efficiency and ultimately, I would think, savings.
And just to, I think this has come out before, Cumberland County Transportation Department will, after all the bills are paid, have a surplus that is accumulated that is not really ours because it's all, PennDOT says it's got to be used for transportation. And in the discussions with Rapid Transit, I think there's a general agreement that some portion of that might be used to improve, expand services beyond our current level, in addition to the Saturday service, which is coming regardless. So we're keeping our fingers. It's not like there's going to be like an endless bucket of money, but anything that we might be able to do to improve and expand services around the margin, because we made a pretty good list of all the things we'd like to see. And so hopefully we'll see some of that as we get more into the details.
There's no financial impact on Cumberland because we haven't funded any county funded clients for transportation. There are Cumberland County residents who are medical assistance recipients who rely on our transportation services daily for their trips for methadone treatment. And presuming that the services are still there, it should not make any difference.
That should be seamless. There should be no interruption in any of that.
Transportation for ID, if that's their main way to get around, so we fund it now, so we will fund that. Looking forward to expansion service Saturday, maybe helping those folks who need transportation to work so that they can be employed. That would be, I hope, because that's one of the big barriers that folks have, is transportation to work.
MH, same thing. MATP, as Jack said, is a way that many individuals who have shelters and medical assistance get to appointments. County-based funds a significant amount of transportation for those folks who are needing to get to services or not health choices eligible. So that would be, as far as any impact on funding is going to depend upon what the rate is, which we don't know yet what that would be. So as far as workload, it will impact positively on workload, especially from fiscal. Fiscal had historically billed for Cumberland County Transportation did all the billing for ID folks at all, because they just have the expertise and know how to do it. Rabbit will be picking that up and doing their own billing, so that will save at least a day a month, maybe more, of fiscal staff person's time to do that. And impacts, if you're looking at the budget, you'll see some revenue decrease expensive, and that's all to do with the whole rapid transit piece, because we won't have that money coming through MHID since we did the billing. It was never MHID money to spend, but it went through. Yeah, so it looks like,
Right.
so it will decrease us, and we're meeting, because transportation is so critical to MHID, and with aging as well, meeting with Rapid Transit to talk specifically around things related to MHID and aging, and transportation. That's set for May 5th.
Are you seeing a growing number of consumers, or have consumers' numbers sort of remained the same?
We're seeing growing number of consumers. I think with Healthy PA, we saw a lot of folks who still and did not pursue insurance, and the cost has precluded them. We have historically served, especially on the mental health side, pretty consistent with the DNA population, folks who are working poor, along with folks, of course, who are seriously mentally ill. If they're not seriously mentally ill, they're typically not terribly involved in our system. So we're seeing a growing number. Now with Medicaid expansion, I think that we will see an increase in treatment service need. I think we'll see that on the health choices side, and health choices will fund those treatment services. Where it will impact the base programs is that as more people then are in those treatment programs and become aware of the competitive employment programs and some of those kinds of programs, we will see an increase there, which is a challenge since we already have fairly extensive waiting lists for these services.
On the aging side, we already have transportation funded for next year. With the increase in services, we will see an increase of expenses in that, but we believe we'll be okay. The number of consumers stay about the same as far as going monthly, and again, with the rate, and hopefully on May 5th, we'll have some of those other answers that are coming up with it.
No impact on the community services side of transportation.
Just one last thing. As you all have decentralized and pushed service provision out to your providers in some areas, these providers have contracts currently with Cumberland County Transportation.
Yes.
Those contracts are going to be then transferred to Rapid. So that's what's being worked on.
Yeah. That's what has been discussed, that those
And there's your
providers,
to do.
right, the contract with Cumberland County Transportation will be contracting with Rapid, so we'll continue that system.
And I believe those that are in place will be recognized as in place.
Absolutely.
So
Yes, that's my understanding.
Exactly.
I think we've tried to go through this all very methodically. As any adventure with Sylvia, it generally turns out to be very methodical, as it should be. And I think, the thing is that Rapid's got this capacity to do these things, and that's a big benefit to us and to you all. A day a month may not sound like a lot, but I
It is, it's a
think for
lot.
your fiscal people, that I think would be very welcome.
Are we expecting the Saturday service to commence right at the beginning of the contract after July 1st?
To be determined, but pretty soon. If not on, then very soon.
And if I hear correctly, that's going to apply to all of our clients, no matter.
Buses are running.
That's what I believe.
Yeah, okay.
In the budget years, you'll see transportation does have a budget, even though Rapid is taking over. I mean, this is taking care of any ancillary costs. to happen after year end, and then at some point, we have to transfer the remaining balance to rec. And so we have to have a budget for that, and that's why you see that. And what we estimated it is, what we estimate the fund balance to be at year end.
And we're thinking that account can be closed out, assuming that all of our payables are received and processed within 6 months or so.
About, yes.
We do have some providers who don't bill on time and
And if we're not completely paid out and comfortable, we may pay a majority of, we'll make a deal with rather than paying most of it, keeping a little bit aside or something. But I don't see a problem. Do you have any questions? Yeah, that is it.
Thank you, everybody.